The pupil. As the diaphragm of the optical system, it fulfills various functions. It supports the retina's accommodation mechanism through immediate light regulation. Aberrations in the optical systems, which together would lead to a veiling of images, are eliminated through the screening of marginal rays. If the pupil is constricted, there's another optical effect, the increase in depth of focus. The shape and size of the pupil is critical for image quality. Inadequate constriction of the pupil occurs particularly in congenital aniridia, traumatic mydriasis, or coloboma of the iris. Inadequate constriction greatly worsens image quality. Another deficiency of a pathological pupil becomes evident with oncoming light. The eye is extremely sensitive to glare because of the deficient regulatory mechanism. These phenomena are greatly potentiated by the presence of a cataract or also pseudophakia. With the already basic loss of quality and visual acuity, depth of focus declines with an increasingly smaller distance with inadequate pupillary constriction. Little attention has been focused so far on these circumstances in cataract surgery. This was primarily due to the fact that there was no suitable prosthesis which could be integrated into the cataract surgical procedure. A newly developed prosthesis for the capsular bag, the Iris Prosthetic System, IPS, now offers the possibility of appropriate treatment. Artificial pupil reconstructions can be created with the use of IPS elements. These reduce sensitivity to glare and greatly improve image quality. The concept of IPS takes into account both optical functions and diagnostic expediency. The function of the IPS elements depends on the tension-free insertion into the capsular bag. The tension-free behavior of the IPS elements permits a predictable and reproducible pupil size. The stability of its positioning is assured by the multi-layer implantation of intraocular prostheses. With capsular implantation of IPS single and double elements, colobomas can be covered and also entire pupils created. Therefore, the implantation of the IPS elements serves various indications in iris pathology in cataract surgery. Covering of colobomas of the iris, the rehabilitation of traumatic and congenital aniridia or traumatic mydriasis, and the treatment of iatrogenic iridotomies or sphincterotomies. You'll now see examples of surgery for these indications. Complicated anterior segment conditions exist in all cases. Here's a condition after a perforating injury which occurred many years earlier with iris and lens involvement in the form of a sonulolysis in the lower circumference. First, a capsular tension ring is injected to stabilize the capsular bag situation after capsulorhexis. Then the nucleus of the lens is mechanically extracted under consideration of its hardness and the zonule apparatus. Specific capsulotomies are performed for this purpose in the upper circumference of the capsule at 10:30 and 1 o'clock. The nucleus is released in a simple way. The cortex of the lens can be easily removed from the capsular bag, stabilized by the capsular tension ring. The specific endocapsular implantation of the intraocular lens occurs with the capsular tension ring in place. An IPS single element, which has a C haptic, is positioned in the area of the coloboma of the iris. In this case, the single element completely fills out the sonulitic area. Normally, it's positioned without tension in the equator of the capsular bag. The initial finding shows a traumatic mydriasis, and in another case, a congenital aniridia. an extreme mydriasis caused by trauma is compensated using IPS double elements. The anterior segment surgery is complicated due to an extensive nasal zonulolysis. For this reason, also in this instance after capsulorhexis, a capsular tension ring is injected into the capsular bag as a preparatory measure for phacoemulsification. With a stabilized capsular bag, the capsular tension ring permits emulsification of the lens nucleus and targeted aspiration of the cortex. After endocapsular implantation of the posterior chamber lens, the two IPS double elements are implanted to create an artificial pupil. Despite the zonulolysis and the implantation of 4 endocapsular prostheses, the result is a stable situation in the capsular bag. The pupil-creating measures in congenital aniridia are, in principle, similar. Again, a capsular bag tension ring and an intraocular lens were implanted earlier because of zonular insufficiency. What you're going to see now is the implantation of a compressed double element. Compression is made easier by an instrument but can also be performed manually. The folding of the double element facilitates insertion into the capsular bag. The stable situation of the IPS elements with a predictable pupil results from the multi-layer implantation technique, as already noted. The IPS double element can also be used for controlled phacoemulsification in extremely narrow pupils. At first, sphincterotomies or iridotomies permit visually controllable lens surgery. After the posterior chamber lens implantation, the iatrogenic iris incisions are covered by a double element with a narrow design. In addition to the wide application spectrum of the elements in the most diverse defects of the iris, this prosthesis has a further advantage in its immediate availability. Thus, for example, one-time primary treatments of severe perforating injuries can be carried out directly by incorporating IPS elements. A severe perforating injury involving the cornea, iris and lens can be seen here. After appropriate treatment of the cornea and lens in the form of corneal oversewing and phacoeresis, the traumatic iris injury is compensated primarily by the creation of an artificial pupil with intraocular lens implantation and the implantation of a capsular bag tension ring. In this case, an IPS double element is combined with a single element. The composition of the implants was selected because the state of the upper capsular bag circumference could not be controlled visually due to the injury, and a C-shaped haptic seemed to be the better choice. The integration of the capsular IPS elements into primary treatment makes it possible to insert them into the capsular bag because the capsule lamellae have not yet grown together. In secondary treatment, this possibility of capsular positioning is either hampered by the adhesion of the capsule lamellae or is no longer possible at all. Artificial iris reconstruction suited to individual findings can be performed in the capsular bag using IPS, the iris prosthetic system. Pupil sizes of 3 or 4 millimeters can be created as needed. In addition to the double and single elements, as an option, an IPS fixation ring is available. Depending on the findings, it represents additional stabilization for the artificial iris reconstruction. Finally, the different color variations also allow the surgeon to take the cosmetic situation into consideration. The IPS, iris prosthetic system, extends the possibilities of surgical procedures in cases of iris deficiencies combined with cataract surgery.